to the May 7th, 2020 business meeting. And the first thing we need to do is have our wonderful county administrator take the roll.
Thank you, wonderful chair. We'll start with staff support today. Caroline Hill, clerk to the board. Stephen Madcore, county counsel. Roll call, Chair Bernard.
Here.
Commissioner Fisher. Commissioner Fisher. Oh,
sorry. Here.
Go. All right. Commissioner Humberston.
Here.
Commissioner Schrader.
Here.
Commissioner Savas is not yet online, but we expect him shortly.
So, Sonia, one little hint about Zoom that Stephen brought up. If you hit the space bar, it takes the mic on and off. Yay! All right, so first, please join me in a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, again, we're holding our meeting virtually. If you've joined us on the Zoom app for this meeting and you are interested in providing public comment, we'll prompt you regarding how to do that when the time is right. We'll have an opportunity to provide your comments to us live. Alternatively, anyone can send a comment to be read during the citizen communication portion of this meeting over email. Just send it at any time during the meeting by email at clackconews@clackamas.us. That's clackconews@clackamas.us. Be sure to include your name and the area where you're when you email. And first up, Gary, what's up first?
Yes, Commissioner Savas has joined us. I did see he was in the attendees section instead of the panelists, so he has been here. Welcome, Commissioner Savas. First up, we have COVID-19 updates. To start, we have Nancy Bush, Director of Disaster Management and Incident Commander for our Emergency Operations Center. Go ahead, Nancy.
All right, thank you very much. Good morning, everyone. So I just want to go through our numbers as before we get onto everything else. So here in Oregon, we have 2,916 positives. There are 115 deaths, 65,060 negatives. Clackamas County has 235 positives, which is up 4 from yesterday. We have 7 deaths and 6,319 negatives. Multnomah County has 793 positives. They have 50 deaths, 14,614 negatives. Washington County has 537 positives. They have 12 deaths and 9,457 negatives. And we still have under 100 hospitalized in the state, which is now at 91. So we do have a lot going on. It's been a very busy week here in the EOC. The first thing I want to note is that the zip code data is now available, which came from OHA. If you haven't had a chance to look at that yet, you can get it off the OHA website, or you can go to Oregon Live, and they do have a map that is interactive, and you can click and to see what kind of data is there in that zip code. So I encourage you to take a look at that if you have not done that. Just a couple things from that. I mean, it is important for us to see that, but it doesn't show us some of the things like where did the person actually get the disease and those types of things. This is actually where the person lives. The state is now having the dentists to go through the Oregon Board of Dentistry for their PPE. They have been coming to the counties asking for PPE, at least for a stopgap, because a lot of them donated to their local emergency operations centers. So the state is now working with them to make sure that they have PPE as we start moving toward reopening and as they open their doors. Public health is now onboarding OHSU interns to assist. They will be a part of the cadre of individuals that we need to have together to assist in contact tracing, which we talked about on Tuesday. So that is one contract we have in place. We have people coming on there, and we're working on other contracts as well for other support teams, which also includes the mobile testing. So all of that is for reopening that we're moving toward. We have mobile showers that are now Moala, which I mentioned last week, the ClackCo Service Center. And next week, we will start a trial on a trial basis, having showers in Oregon City at Father's Heart. Father's Heart, just to let everyone know, was actually doing 108 showers a week before COVID. And because they can't bring people inside the building because of social distancing, we're trying to see if we can help offset some of that need there. We continue to work with Milwaukee and getting a shower, mobile shower placed there as well. And that's been, those talks have been going very well. Our advanced planning group is still working with public health on reopening. And the other thing is for that advanced planning group, we're talking about and planning for what if we do have another spike or another hump. However, it all works out later in the year, which could be coming in the fall. And what may that look like as we reopen and get everything reopened, and if that continues to happen, or we do have that spike in the fall. So as you can imagine, some of that long-term planning is a little difficult, but we're trying to do that the best we can. I also just want to mention too that we will be having some warm weather this weekend that is unusually warm. We have been doing a lot of wildland fire planning that is related to COVID, but also our normal wildland fire planning. Smoke can impact COVID patients. So even if we didn't have a wildland fire here in our county, as you know, in past years, we've had some very heavy smoke, and that is really for anyone, obviously, with any kind of lung issues, and it irritates if anyone has COVID as well. So we're thinking about that. We're thinking and working with the Red Cross. It's like, what if we do have to open shelters here locally? How do we do testing, and how do we make sure that those individuals are 6 feet apart? Because, and we have to change all of our sheltering paradigm from the past, and making sure that we're thinking about that in COVID ahead of time before we have to open a shelter to shelter those that may be displaced because of a wildland fire. So we continue to do that as well. And I think I will stop there and see if there are any questions.
Any questions? Paul?
Yeah, sorry my link didn't work and let me in, but voila. So Nancy, really, I saw the zip code thing on the OHA website. Nice addition. My question is that when a state is evaluated nationally with regard to COVID cases, I'm still noticing, like I mentioned last week, that nationally, Oregon is one of the states that the numbers are, by their interpretation, increasing. Mm-hmm. And yet our graphs indicate that we're kind of like on the decline, right? So am I assuming the measurements as one would assume, or what does it take to get a decline? If we actually are declining in the number of new cases, what does it take to be recognized as such? Or am I misunderstanding what the
yeah, I mean, they look at the daily. So right now we've stabilized a little, like daily. I mean, Clackamas County is showing that decline, but if you do look at the Oregon in general, the Oregon graphs, it hasn't come down as much. It's starting to decline, but they're looking at that daily number of new positives, which is, and then comparing it to the other states, and other states are coming down. Some of the other states are coming down more quickly. So that is part of it. I don't know everything that the feds are looking at, but I do know that as far as the state is concerned, we're not coming down as quickly as some others.
Okay, so I think that's almost a consequence of flattening the curve early, right?
It is.
I think the way it's probably perhaps perceived or portrayed is not really quite right. If we had a super high numbers and we didn't implement social distancing, our numbers are really high, and obviously our rate would be declining if we would have implemented the social distancing later versus earlier.
Yeah.
So
So
Seems like
part of it is,
target success.
yeah, part of it, yeah, exactly. Part of it is because we have been successful. This state has been very successful. And I've seen articles in the New York Times talking about how, Oregon is still, one of the leading states in how we've been handling the situation.
All right,
Humberston.
any other questions?
Yeah, Commissioner Humberston.
Ken?
Quickly, Nancy, I don't know if this would be of use to you, but Ted Kuntz, who is the chair of the Fair Board, is a very experienced incident commander on the ground. Might be useful to discuss with him how you might do COVID-related separation if there's wildland fires that require people to leave their homes and whatnot. He could be a great resource. And the other is there's a big fire in the panhandle of Florida as we speak. People are being evacuated. There may be some folks there that you could contact that could give you additional helpful information.
Yeah, and I know Ted very well, so.
Yeah.
Suspected you might, but just thought I'd throw it out there. Anytime we can get additional sources of help and information, it's good for us.
Yeah, well, and it's definitely never above us to take what others have learned and put that into practice here. So we definitely are looking into that as well. Thank you very much.
You're welcome.
Martha, did you have a question?
No, I'm okay.
No? All right, anybody else? Well, thank you, Nancy. I appreciate your hard work. Like us, I've spent all day, every day on Zooms. You went to Oregon City last night till after 9 o'clock after working a full day. Thank you. Thank you very much.
Thank you guys for your support as well. It means a lot to us here.
Thank you. All right, Gary, you're up.
Thank you also, Nancy. So next, Dylan, if you could please put a slide on the screen. We want to recognize several local businesses that have contributed to our pandemic effort here in Clackamas County and around the region, and thank them for their fantastic work. You can see it on the screen, but let me read that to you. Miles Fiberglass provided Clackamas Water Environment Services with face shields for its field workers at cost. The Oregon Chinese Coalition, and I'll mispronounce this, Acon Biotech donated 500 K995 masks for our dental clinics. The Clackamas Dental Society donated personal protective equipment to our dental clinics so we could safely continue providing emergency services. And a local Lego League team, the 20540 Master Builders, teamed up with the Tetravoid Robotics Club to use 3D printers to create 50 face shields for our dental group. So thank you to these local businesses and nonprofit associations for their work and contributions to the public of Clackamas County and our first responders. We really appreciate that.
And actually, Gary, I'm going to make a minor correction. It's actually the Oregon China Council. So, but that's okay.
My apologies. Thank you, Commissioner. Thank you.
No, that's not nobody's fault. Just
Very good.
I'll tell Jen that, we did good. Okay.
Very grateful. And thank you, Commissioner Schrader, for your help in making that happen as well. All right.
And hopefully we didn't miss anybody, but thank you everybody for staying home and staying healthy, and any contributions you've made to the county. I know we have face masks that we use when we do boxing food on Mondays that somebody donated. I don't know whom that somebody made, so thank you.
All right, so that is our COVID update for today. If you're ready, Chair, we'll move on to the other business on the agenda. Next is a public hearing, which is a second reading for a resolution amending the Transportation System Development Charges Methodology Report, modifying the Transportation System Development Charges rate schedule to establish new rates for single-family residential homes and accessory dwelling units. Deidra Landon from Transportation and Development will present.
Good morning, Commissioners. Thank you for having me today. Is everybody able to hear me okay? Perfect. So on April 16th, I presented an amendment to our County Transportation System Development Charges, or SDCs, that would establish new rates for detached single-family residential homes and accessory dwelling units. Today, I am asking that we adopt the new rates. I have 4 primary points to go over today. I'll start with a little background, then discuss the work group recommendations. We will review whether the proposal will be revenue neutral. And finally, we'll discuss our outreach efforts that were taken and the next steps. So starting with just a little bit of background. SDCs are one-time fees that are assessed to new or expanded developments to help cover the cost of adding capacity to existing infrastructure systems, such as roads, water, sewer, storm drain, and even schools. You cannot perform maintenance on existing systems with this money, but you can add capacity to existing roads by adding new travel lanes or adding a traffic signal that will move more cars through an intersection each day. The county adopted a new transportation SDC plan in January of 2018. And at that time, the board showed interest in the concept of adopting residential SDC rates that might be based on home size. I was asked to revisit the idea of a tiered residential rate to determine whether there was a link between home size and number of transportation trips in Clackamas County. So in November of 2018, the county brought together a group of stakeholders to consider a tiered residential rate. We found that local travel data does support a tiered residential rate structure for detached single-family homes, and the work group recommended a 3-tier rate structure for these units. In 2 of the 3 cases, the rate would be lower than the current rate. Homes larger than 3,000 square feet would increase from $4,590 to $4,840. Homes between 1,700 and 2,999 square feet would lower to $4,579, and homes up to 1,700 square feet will lower to $4,015. We also found that there is little local travel or permitting data available for accessory dwelling units or ADUs, so the work group began looking at other options. Clackamas County has 6 residential rate categories adopted: detached single-family homes, multifamily apartments, condos and townhomes, mobile homes in a park, assisted living, and senior housing. Currently, we use the multifamily apartment rate for ADUs. After reviewing the adopted residential categories, the group recommended lowering the current rate by using the adopted trip rates for condo and townhomes as a baseline instead of the multifamily apartments. This assumes an average of just under 6 trips per day. And the group proposed that ADUs between 450 to 900 square feet will pay the full condo rate of $1,401, and ADUs between 200 to 450 square feet would pay 50% of the condo rate, assuming just under 3 trips per day. The final step in the analysis was to explore whether the recommended TSDCs would be revenue neutral. With an average of 3 ADU permits being issued each year in Clackamas County, we would anticipate losing about $1,200 per year to the reduction for ADUs. Based on the distribution of permits since 2010, we would expect to collect about 98% of our forecasted detached single-family home assessments. Our estimated maximum annual impact is about $25,000. Which is minimal in the context to the TSDC revenue projections, which top $210 million over the life of the 20-year plan. We performed public outreach a few different ways. We sent a targeted email out to more than 3,000 contacts regarding the proposed changes, and I received an email with clarifying questions, but I didn't have any concerns or formal comment. The draft changes were posted on our website 2 months ago, and we worked with our representative at the Portland Metro Home Builders Association, both on the work group and to inform their membership of the proposed changes. And ultimately, we received a letter of support from the Portland HBA, which is included in your packet today. So what are the next steps? I have programmed a formal TSDC plan update in our budget next year. This will allow us to revisit this policy decision while we review construction costs and project lists to bring them current. I'm here today seeking approval of the resolution adopting the tiered residential TSDC rates effective July 1st of 2020. I would like to note a consumer price index CPI adjustment of less than 1% would be applied to the new rates on January 1st, 2021 per our study session on April 28th. So do you have any questions for me about this proposal today?
No.
Commissioner Savas?
Yeah, well, Deidra, I always appreciated your work. You do a magnificent job with numbers and spreadsheets, and I think the work here is exemplary. So while I know that you and we are data driven, I know there's a few areas that of the unknown. I've got a little bit of discomfort and concern about the areas where we don't have the data to support it. But as you outlined, we could revisit this in the near future, or next year or the year after. And therefore, with reluctance, unless I hear something different during this hearing, I will support it. But I just have some concerns. But there again, the opportunity to revisit it as data comes in will help.
All right, any other questions? All right, so I'll open the public hearing and go to Dylan, see if anyone would like to testify on this matter.
Thank you, Chair Bernard. I'm Dylan Blaylock with Public and Government Affairs, and I'll be coordinating both public comment for this specific public hearing and later on for general comment. If any attendees with us would like to provide a comment specific to this hearing, transportation system development charges with the rate schedule, you can do so now by utilizing the raise hand feature on Zoom. Again, we'll open up regular public comment on any topic related to county business in just a bit. But if you have a comment related to this particular public hearing, use the raise hand function. Seeing none, that's it, Chair. We don't have any.
All right, we'll close the public hearing and entertain a motion.
Mr. Chairman, I move to approve.
Second.
All right, it's been moved and seconded to approve a resolution amending the Transportation System Development Charges Methodology Report, modifying the TSDC rate schedule to establish new rates for single-family resident homes and accessory dwellings. Any further discussion?
Mr. Chairman, I'd just like to comment. I thought Deidra did an excellent job of analysis on this. It's very time consuming. It's also an issue that's been hanging around for a number of years, and it's good to see that that some action got taken on it and we can move forward. So Deidra, thank you very much for your hard work.
Thank you so much.
Ditto. All right, so please, Caroline, please poll the commission.
Commissioner Savas?
Aye.
Yep. Commissioner Humberston?
Aye.
Commissioner Fisher?
Aye.
Commissioner Schrader?
Aye.
Chair Bernard?
Aye, motion carries unanimously. With that, we'll move on to the next issue. Gary?
Yes, next is the consent agenda. Caroline, if you'd like any help reading that, let me know. Otherwise, start it off, please.
I think I got it. Give me 1 second as I bring up the consent agenda for all to see. Okay, for today's consent agenda, it's under Health, Housing, and Human Services, approval of amendment number 2 to intergovernmental subrecipient agreement with Foothills Community Church, Molalla Adult Community Center to provide Older Americans Act services for Clackamas County residents. Approval for amendment number 5 to agreement 8904 to a professional services agreement with dental medical staffing for temporary staffing services. Approval of the intergovernmental agreement with Multnomah County for participation in the Public Health Officer Program. Approval to accept a grant award from Oregon Community Recovery Fund of the Oregon Community Foundation for COVID-19 operating expenses. Approval of amendment number 6 of the intergovernmental agreement with Oregon Department of Education Early Learning Division for Early Learning Hub. Approval of amendment number 7 of the intergovernmental agreement with Oregon Department of Education Early Learning Division for Early Learning Hub. Under the Department of Transportation and Development, approval to partner with Molalla River Watch in applying for an Oregon Watershed Enhancement Board grant for the replacement of the Woodcock Creek Grim Road Bridge number 06267. Approval to apply for a build discretionary transportation grant to replace the bridge across the Bull Run River.
Yes.
Under elected officials, approval of previous business meeting minutes. Under Juvenile Department, approval of amendment number 10 to the intergovernmental agreement with Multnomah County for secure custody detention beds at Donald E. Long Detention Facility. Under Public and Government Affairs, Board order for an extension of the cable television franchise with Beaver Creek Cooperative Telephone Company. Approval of an intergovernmental agreement with Multnomah County for use of videography services of Clackamas County on-call videographers. Under disaster management, authorization for disaster management directors to sign the community block grant COVID-19 HUD grant agreement. Authorization for disaster management director to sign the emergency solutions grant COVID-19 HUD grant agreement. Under development agency, execution of property use agreement with Comcast Cable Communications Management. Under water environment services, approval of contract amendment number with RL Reimers Company for the Tri-City Hypochlorite and MPW Pump Station Improvement Project. And that concludes the consent agenda.
Anyone wish to pull an item from the consent agenda? Seeing none, I'll entertain a motion.
Mr. Chairman, I move to approve the consent agenda.
Second,
Been moved and second to approve the consent agenda. Any further discussion? Caroline, would you please poll the commission?
Commissioner Savas,
Aye.
Commissioner Humberson,
Aye.
Commissioner Schrader,
aye.
Commissioner Fisher,
Aye.
Commissioner Bernard, Chair Bernard.
Aye, the motion carries unanimously. Thank you very much. And next up is citizen communication. I'm going to jump ahead of you, Gary.
All right.
Citizen communication, Dylan?
Great. Thank you again, Chair Bernard. Now it's time for public comment on any topic related to county business. So if any attendees would like to provide a general comment or pose a question related to any aspect of county business, now is the time. I see one has just gone up. You can do this by utilizing the raise hand feature now on Zoom. That's on the Zoom bar at the top or bottom, depending on your device. If anyone is on the phone, but they are not on the phone. And after we have this individual chair, I do have one comment that's come over email as well. But first up is going to be Marvin Watkins. Marvin, just 1 second. And then Marvin, if you can go ahead and unmute yourself, then you are going to be on with commissioners. You can go ahead. Please keep your comment to 3 minutes and identify yourself and your area or city of residence.
Actually, it's Deborah Watkins. I'm using my
Okay.
husband's phone.
That's fine. Great. Yeah, we can hear you. Thank you.
Okay. I live in Gladstone. I'm 71 years old, and I think that every day we get up, we take risks. And I have a self-contained trailer that we purchased last year and were able to use only twice. I think Governor Brown is being very dictatorial regarding the parks. My trailer is self-contained. Most spaces in the state and county parks are at least 6 feet apart. I want to use my trailer, and if the parks don't open soon, I guess we'll go to Montana and utilize their parks. The other thing is county and state revenue that you are not getting. And I'm sure you have plenty of people in the Parks Department that would like to go to work. So I urge the county commissioners to open up your parks. And if you have any influence with Kate Brown, she needs to open up the state parks. You know, I don't understand why dentists and hygienists can work, but our state parks can't open, our county parks can't open. We can't go get a haircut. We can't go get a pedicure. I don't understand her logic at all. And I don't, you know, I don't think the park should have been closed in the first place. I can understand you roping off equipment, play equipment and swings because you can't sanitize them, but there's no reasons why we shouldn't have been able to walk in our parks. And I wear a mask and gloves wherever I go. I'm a responsible adult.
Well, thank you. I encourage you to watch the 11 o'clock television at 11 o'clock. The governor is providing a statement on opening up Oregon. So I look forward to watching that if we have time. Thank you for your call.
Okay, thank you very much, Deborah, for that. And then I do not see another comment on Zoom, but I do have a comment, Chair, that has come in via email. It's from Laura Davis, who identifies as being on the edge of Happy Valley. Dear County Commissioners, our local businesses are dying. Forcing businesses to stay closed because of a virus that kills such a tiny percentage of people is just not sustainable. People need to make their own decisions now about whether they should go to the grocery store. We should also be allowed to get a haircut, etc. Too many people are out of work and out of money. Thank you.
I think we all agree that Clackamas County wants to open as soon as it's safe to do so. We are under the same orders that everyone else is. Stay home, stay safe, which is the governor's order. We withdrew ours and are waiting to and working hard to meet the requirements that the governor requires. Paul, did you want to say something?
Yeah, thanks. I just wanted to maybe ask legal counsel Madcor for his confirmation of what our understanding is. There's been a lot of discussion about whose authority is it. I think some people think that the authority to open or the people that are not allowing whether it's parks or whether it's businesses to go back to work or their local governments. But my understanding is in the state structure, that is in Oregon state structure, that is a call that the governor makes. And so I want to confirm that because there's been people challenging the constitutionality that what the Constitution says. And I'm not sure if they're referencing the US Constitution or the state Constitution. And in this case, let's just talk state just for clarification. But it is, as we respond, I keep on telling folks, this is in the hands of the state or the governor's office. Is there anything you can add to that or validate, please?
Commissioner, you're correct. There is an order from the governor that essentially closes down a lot of businesses, tattoo parlors and barbers and things like that. She also closed down state parks. The decision to close down county parks was a county commission decision. Her order does not close down county parks. Her order closes down state of Oregon parks and recreation areas. Does that answer some of your question?
It does. And so let me give you a couple examples. For example, the lady that just called in from Gladstone that has used her trailer to reside in. And I think I mentioned this actually a month or so ago in one of our meetings, not sure which one it was, that, because I know there's a lot of people that travel, and they live in they retire, they buy either a nice trailer or a nice motorhome, whatever it may be, and they reside there and they move around. And that they would otherwise, if all these parks were closed, they would essentially be on the street or, somewhat homeless, so to speak. So that's one issue. And whether that is a county facility, those that are county facilities, it would seem like it was our, as you indicated, our option, authority to close those parks. The other avenue is that the signage on the NCPRD, so I want to clarify that when we say county parks or district, the signage that NCPRD has on the closure of its parks is that basically, I'm not going to read the verbiage, but the verbiage basically says by order of the governor. So it's referencing the governor. And so my question is that which one is it? And I think you clarified, but it seems to me like NCPRD closing the parks, what is I'm understanding is a local decision, not a state decision.
Well, it depends on that, Commissioner. I think her order has recreation areas like swimming pools and gyms and things like that. So if you're talking about signage that's at the aquatic center, then yes, that would be pursuant to the governor's order. If you were talking about Hidden Falls, that would be a Parks District decision.
Yeah, I'm talking about playgrounds. In this context, I'm talking about playgrounds, parks that don't have any swimming facilities, have nothing like that.
If it's an NCPRD playground without swimming pools or without a lot of common recreation areas, that would be a parks decision, NCPRD decision.
Okay, So, and that's my understanding. I think that's maybe we need to correct the signage on that and literally say it's our call. I think it's kind of confusing when we have parks in other parts of the state that are open with limitations that are open. And I think people are saying, well, why are they open if it's a governor's order not to? So that's part of the confusion. I think we need to be consistent with the law, and our messaging should be just as consistent.
Well, if she said she lives by Happy Valley, it's likely it could be Happy Valley Parks that she's referring to, but she never said she resided in the trailer. She wants to travel and go to parks, and those parks are not open, those state parks. But again, I would encourage her to listen to the 11 o'clock governor update and see what she says. It's supposed to be big news. All right. Anyone else?
Yes, we did have another hand go up, Chair, but I noticed Commissioner Humberson's hand was up before. Did you want to say anything, Commissioner Humberson? Are you okay? Okay, good. Okay, so then the next comment, I'm going to bring over Gerald Murphy. Gerald, if you want to unmute yourself, and then you can go ahead and, okay, there you go. And please give your name, your area, city of residence, and keep your comments under 3 minutes. Thank you.
Good morning, Commissioners. Gerald Murphy, or Murph, from Brightwood Rhododendron area. I recently had read an article of testing going on, which is of the utmost importance as we start to open up. But the testing this was an article that came out of Paris, France, where they're testing in the wastewater treatment plants.
Yeah.
And able to see that the virus is spreading in certain areas and they can get a jump on it. This is a lot cheaper than testing individuals, and I think it's something that we should look at. I thought I'd bring it to your attention just for this reason.
Thank you, Murph. Anybody else?
No, Chair, that is it.
All right, thank you. We'll close citizen communication and we'll go to our outstanding county administrator update.
Thank you, Chair. So Commissioners, some good news that our county departments are doing for the community to share with you this week. The staff of our roads crew within transportation and development continue to receive positive comments from the public. Recently, resident and bicyclist Beth wrote to us, "I just wanted to let you guys know you've done an exceptional job this spring sweeping Sunnyside Road's shoulders and keeping the bike lanes clear of debris. I commute with a bike, and it seems like every time I think to myself that the lane is getting a bit sketchy with nails and glass and sand, I spot you guys sweeping it the next day. Thanks for maintaining this so well. Keep up the great work." So thank you, Beth, for your comments, and to our roads crew for their excellent service. Technology Services has activated the county's first free Wi-Fi hotspot this past weekend. This is an initiative that was undertaken by your direction, Commissioners, a few weeks ago, with the goal of ensuring that our underserved areas of Clackamas County receive reliable internet access during this ongoing pandemic. The first Wi-Fi hotspot went up in Government Camp, and since that time, we have activated county hotspots in Boring, Sandy, and Welches, with 2 more in Canby and Hubbard expected to be up and running by the end of the day tomorrow. So thank you to our staff in Technology Services, especially those in the Clackamas Broadband Exchange Program, for providing this service to our community. That's my update for today, Commissioners.
There's one thing I would suggest next time is the actual location. I know the one in Government Camp is at the fire station. They do have to be near it to use it. So I think that would be helpful next time.
We will have that online if it's not already, and I'll ask Dylan, because I know Dylan's supporting this. We'll have it online, so we'll see the exact locations. Thank you, Chair.
Thank you. We'll move on to Commissioner Communications, and Martha, you're up.
Oh, I get to go first this time. Okay, let me pull up Caroline has a slideshow for me because I wanted to highlight our food distribution efforts that we've been doing here in Clackamas County. And this is the Clackamas County Sheriff's Office, County Social Service Division, and the Emergency Operations Center. We formed a partnership in response to COVID-19 to address food insecurity because it is a growing issue in the county. It's called the Community Care Initiative. And with the increase in unemployment rates that we're experiencing and the reduction of services to vulnerable populations, individuals and families have really had to have heightened need to access food resources. And there are three components to this whole piece. One is emergency food box delivery, weekly deliveries to our most vulnerable residents, and public food box distribution. These deliveries are occurring throughout the county with households living everywhere from Lake Oswego to Welches to Malino. And we also provide food assistance to houseless individuals through the social services outreach programs. We have provided 100 houseless individuals with food over the last month. And we've also provided fresh fruit and vegetables to households who are sheltering from domestic violence through our partnership with Clackamas Women's Services, which is our nonprofit partner. On April 20th and 27th, free food boxes were distributed to the public at the Sheriff's Training Center in the afternoon. 546 boxes were provided to households that included 1,996 individuals. 34% of the participants reported that this was their first experience receiving a food box this year. So here's the overall performance for April. Total boxes given was 1,649. Total households served were 1,450. Total individuals for delivery and public only, 2,744. Total boxes delivered, 1,103. Boxes for distribution were 546. And total volunteer hours, and this is the crux of the matter, has been 724 hours. And I want to just thank my colleagues. I know that Ken and Jim have been religiously going there every Monday as well. And we get there, and it's actually a lot of camaraderie. It's really feeling like we're making a dent and helping people during this crisis. I get to go to Lake Oswego and Canby. Ken gets to go all the way up to the mountain, though. He's been the star, going, I think, pretty far with his truck. And then I know, Jim, I think you've mostly been covering Oregon City. So thanks to my colleagues, but really none of this would be possible at all unless we had the efforts of our volunteers and county staff members. They are the real heroes. You know, we kind of show up and try and do the groundwork with them, but they're the ones that have started this. They're the ones that the Sheriff's Office has pulled this together, and they really, really deserve the kudos for this. So the Salvation Army is going to be providing a weekly food box distribution starting May 8th at the Clackamas Town Center. So we're going to be shifting our focus to the rural communities throughout the county. And today they're going to be distributing food at the Clackamas County Fairgrounds in Canby starting at 1 p.m. At Welches at the old Dorman Center site located at 25400 East Salmon River Road at 2:30. And basically we are now starting to reach out to the rural communities to see if we can help with their short-term needs. So we need volunteers. Bring a mask, bring your gloves. We try and keep 6 feet of distance between us. But it's a great opportunity to volunteer. So to learn more about the Community Care Initiative, visit www, I think Caroline's going to pull that up, clackamas.us/pstc/CCI, or call 503-794-8008. This is a great initiative. Another part of it is that we are also getting lists of elderly people, of folks who may be at risk, that I do my phone banking with that, and we just do a call check-in, see if people are okay. And I just got my second list this week, so I'll be on the phone all day, Jim, much like you, I think. So, but thanks to my colleagues, it's fun working with you. Thank you, Ken, for giving me the Ironworker sweatshirt that we wore at the same time. And I think Commissioner Savas, you've done some drive-by deliveries, haven't you? I think with this. But
I did the Thursday distribution
Right.
which I'll touch on a little bit too as well.
Good.
Thank you.
Okay, well, that's my update. It's a great program, and it really shows how this county comes together for our citizens here, and are really direct and on the ground level. So thanks, everybody. There
Great,
you go.
Thank you, Martha. Commissioner Fisher.
Thank you, Chair Bernard. I so appreciate seeing all of you the couple times a week that we do these Zoom meetings. I'm really feeling, as I know we all are, the excitement and yet concern about how we are going about ending this closure of our economy. And it's really caused me to reflect on these last, gosh, it's been over a month and a half now that we've been dealing with this. And there are certain things that I really have struggled with, mostly personal. Not seeing my daughter and not seeing my grandchildren has been a real struggle during this time. But there's been many things that have been really, really positive. And I just want to focus on that for a minute. Things that I want us to remember that actually really, really work as we transition back to the way our economy, the way that we hope it will be. There's things I want us to hold on to. Number one, I want us to hold on to just everything that Commissioner Schrader just talked about, the importance of prioritizing what matters. People that experience food insecurity, it's just not okay that people go hungry in our community. And it's wonderful that we as a community have rallied around that and found ways to resolve it. We need to continue focusing on those that are most in need, like we're doing now, those who are houseless, those that are in congregate care facilities, those that are in foster homes, those that are our most vulnerable people that we have prioritized, taking care of our migrant farm workers, those that are most vulnerable and that we have been actively planning about. Other populations, we have our GO teams going out, we have things in different communications in different languages, we have prioritized reaching out to all of our communities. These are the things we have to hold on to and know that these are the parts of government that really work and that matter, even if we are not in a pandemic. For these populations, life continues to be an emergency or a public health emergency or a crisis. And it's nice that we have focused on that. A couple other things I really have appreciated that I do not want to lose track of, and I know I miss seeing you all so very much, but I do think that the quality of our communications in many ways have improved. I know that Chair Bernard, through his leadership through this pandemic, has been there every step of the way, taking my call when I had something to offer. I so appreciate that leadership. He has really stepped up as our chair and really helped through this crisis. I actually, just a little confession, I like calling him and having him take my calls. So I don't want that to end either, Chair Bernard. We're gonna keep up this great communication. And I just appreciate, I've really seen the strengths of all of our commissioners, and I've known about all of our individual strengths, but I've seen them really flourish during this time. And I really appreciate us. I appreciate Paul's attention to the details even more now than I ever have. And I really appreciate, Ken, your advocacy on internet and broadband. It's been so critical. And Martha, your heart through all of the things that you have promoted.
Nice of you.
So important. So we are transitioning. The governor's going to be talking today. We are planning. The industries are planning. We will be getting everything together. We're getting the tests together. I'm so pleased that we will have capacity for testing. We will eventually have the PPE that's required. We are going down. The curve is going down. We will be able to have those 14 days of showing that we are going to be opening. We have the structures in place with our tri-county coordination. We are going to be able to do this. But as we do, let's not lose sight of what we've gained through this most challenging process and keep government operating efficiently and effectively for the benefit of our residents.
Thank you. Paul.
Yeah, well, I want to build on Martha's comments and reflecting on what's helping feeding the people in need. And yeah, it was last, as I kind of mentioned, last Thursday was very impactful to me in the sense that when you are seeing the faces of the people pulling up in their cars and knowing that these are very difficult times, and you're loading food in the back of their cars, and you see how long the line is. It's very touching, and it's also concerning. I do want to say that it was also a pleasure to see all the volunteers that were there helping. This is a huge lift, and I know search and rescue organizations, other organizations are participating in filling the boxes and the bags and sorting all that out. And I know that's changes, and hopefully either later today or Friday, now there's an opportunity for Friday, I'll be able to continue my efforts with that. I've had my nose to the grindstone at attending all of these webinar, Zoom meetings and teleconferences, and trying to stay on top of every little bit of information I can to help the businesses, our community, help guide or provide ideas during this stressful time, and make sure that what we're communicating is accurate. I think that's really important, because the better and clearer we communicate, whether it's to our constituents or to the governor's office or amongst ourselves, that we are really working from a solid foundation of the right data in this very complicated crisis. And I am not in the medical industry. That's not my line of work, but I'm certainly learning quite a bit. When it comes to we had a long discussion on Tuesday about the criteria, about how we reopen Oregon, how we reopen Clackamas County and the businesses. We need to make sure that they're achievable. We can't set up and raise the bar so high that a business with its sincerest, best efforts they can't achieve, and also make sure we convey the safety to the employees, the safety to the people that are walking through the door, all the citizens, that what we do is very coordinated. So I know everyone is very mindful that when they see someone who's not abiding and taking the precautions, that they are being they're reaching out. And I think that's important, that we kind of monitor ourselves as a community, and also be understanding. I don't want people to think that cohabitants of the same household, like if for example my wife and I decide to go for a walk and we're standing side by side, we're still we're not obviously physically distanced, right? But because we're in the same household and we're cohabitating, we are not disregarding those rules, but people don't know that maybe that we're the same household. So things like that I think are confusing. I think people get kind of worked up and we need to kind of discern or understand that maybe they cohabitate and it's not putting anyone at risk. So when it comes to the prerequisites and on that, we got to be mindful. Small business is the backbone of this country. It's the backbone of our county and our state. And we've got to figure out a way to get the materials, a PPE, and all those prerequisites aligned. So again, that they're achievable. And that I call them the keys to opening up Oregon, if you will. Some are calling it gating. There's a lot of different terms, but we got to make sure we know what all the keys are and assist, whether it's PP or the materials, assist that as best we can and make that happen. The other one that I want to talk about just a little bit is stress in the workplace. We've all had and we all experience at the workplace going to work that we have stress. And now that we are at home, we don't have that period of time between that stressful situation as we drive home, because we're not driving home any longer. A lot of people are working from home, that stress is experienced maybe by our family members or our friends or whatnot. So we have to be extremely conscientious that we have a little bit of time to decompress after a stressful situation, and realize that it's a little bit harder sometimes when you're at home amongst family members, that kind of stress can result in spikes in domestic violence, which we're seeing across the country right now. It's very, very important that we just find a way. Yesterday, we had a work session really on a topic like this, basically, and there is something called the Dave. I thought I wrote the number down, but I didn't, so I apologize. But maybe next week we can have that phone number. But it's called the Dave Rompery Oregon Warm Line. It's basically a call line that you can at least talk to someone. And there's some other hotlines as well. I think it might be a good idea, maybe Gary, that we include that in our weekly meeting as far as a posting, so people can see that and know where to find those particular lines that apply to their situation, so they can get through or talk through an issue. And lastly, I'll close with this. It's going to be a very odd Mother's Day. To all the mothers out there, happy Mother's Day. Get a little bit choked up on this topic, but it's gonna be very difficult. And I know that people need to be cautious, but they want to give their mom a hug, and maybe they're concerned that at their home place, maybe they've been exposed to that, and putting mom at risk might be something we all have to consider. So it's just a terrible situation that we have to be. There's gonna be a lot of mixed emotions about how we cope with that. But I did want to say happy Mother's Day to all the mothers out there. Thank you.
Thank you, Paul. Ken?
Under the circumstances, because I want to hear what the governor has to say, and that's in about 2 minutes. I don't think there's enough time, so I will pass. Thank you. And I'm going to sign out now so I can get over and make sure I actually hear what she has to say.
You got 3 whole minutes to run across the room, Ken. Just kidding. Bye.
Bye.
So I'll be quick too, because I also want to watch. Just last night when we're talking to the 6 counties that we are aligned with health region, there are a couple questions we're going to be asking the governor. And one is about the rate of flu rate at this date compared to last year. Well, the problem was our flu rate was 0. How do we get below the flu rate of 0? It's not possible. So we've got to ask the governor to clarify what she means by that. And then we're still challenged with PPEs. And one thing I think that we should make sure is understood that it's not, well, our goals are achievable. It's we have to achieve the governor's goals in order to open, and we're working hard to do that. Of course, rural communities are more challenging. The other is contact tracing. They're talking about hiring 600 people to do that. In our county, it's over 100, around 130. Are these full-time people? Are these people we contact in emergency situations? There's still some confusion there. So with that, happy Mother's Day. Wish mine was here to celebrate with me, but she's not. And have a great weekend.
Chair Bernard, real quick. Commissioner Fisher shared the phone number that Commissioner Savas had mentioned for Dave Rompery Oregon Warm Line. It is 1-800-698-2392. Again, 1-800-698-2392.
Thank you. Great. Have a great weekend.
Thank you.
Bye.